जय जिनेंद्र देवेंद्र भाई.
Hi, Cyril. I think Riddhi's on. She's going to be talking soon. You give another minute to
Okay.
just get to join in, maybe just
Yeah,
another minute.
sure. Not a
Then you
problem.
can join
I
her
will
about that.
also make her a co-host.
You can make her make me host, doesn't matter. I'm here. So
Okay. Hey, Jai Jinder Riddhi.
you go to lecture also yourself?
Yes, I have another lecture, so I'll just after this one I am leaving.
Yeah, yeah. No worries. You can make me
Yeah,
host. Like, no worries.
yeah. I'll make you a host now. And this is also a live right now, so no worries. Okay, everything is already been set up. Anytime now you can start.
Okay, cool. Okay, Riddhi, you're good to start.
All right. Hi, everyone. Can you hear me okay? Okay. So, hi,
Let
I'm
me introduce
Riddhi.
you. So you can introduce yourself. You want to do it yourself? You can do it yourself. So
Um,
Riddhi is a internist, and she's here as a hospitalist in Orlando Health System. She's trained many parts of the country, and Philadelphia. She's a mother of one beautiful daughter, and her expertise is a wide range of internal medicine, obviously, and she manages all the patients at the hospital that come in sick acutely with all kind of conditions, and then she would then consult with professionals. She manages the whole team, post-op, pre-op. So they're the go-to people when you get to hospital once you get past the emergency room. So a whole array of nasty things, good things, bad things they can handle. So she's very diversely skilled. So we're so glad that she's agreed to present on diabetes. Many of the skills she has, we just picked this. So, Riddhi, welcome.
Thank you. Hi. Thank you guys for joining. I am just trying to figure out how to share my screen because I have not used Zoom in a while.
There
I
should be a
think if I go to these three dots, maybe.
there should be a share button, and they can share screen.
I
If you look
see
up
it
top,
shared
there should
in.
be at the bottom. At the bottom is a green arrow.
Yes, I
Green
got
share. Click
it.
that, and then share your screen. And then in your screen, navigate to where you think is your PowerPoint.
Okay.
There you go. Perfect. You got
Uh,
it.
okay. You guys can see this okay?
Yeah, this is
Okay.
good.
Yeah.
So my first talk is going to be on just the basics of diabetes and kind of understanding it, what the pathology is, what some symptoms are, how it's diagnosed, and kind of the sh short-term and long-term complications of it and the different kinds of diabetes. So, um, all right. So prevalence-wise, okay, can you guys still see it? Sorry, I pressed a button. So
You see everything.
prevalence-wise, diabetes is a very, very common disease. I'm sure all of us know someone or multiple people who live with diabetes. Data from 2021 shows that about 10.5% of the global population from 20 to 79 years old were living with diabetes, and this number is just expected to grow more and more over the next several years to decades. So it's about 1 in 10 um, people living with diabetes between the ages of 20 and 79. Key terms that you'll hear me mention, just kind of simple terms. Glucose is blood sugar, which is the main source of energy for the body's cells. Insulin is a hormone that's made by the pancreas, which is an organ in the body that's in the abdomen, kind of near the stomach. It regulates blood sugar. Insulin is kind of, I think of it as the key that allows glucose to enter a body's cells for energy or for storage. And then carbohydrates, that's what we eat, is the body's main source of energy, glucose. There are simple carbohydrates, which digest very quickly in the body, and more complex carbohydrates, so starches, fiber, these digest more slowly in terms of the kind of just some common simple versus complex carbohydrates. So anything, super sweet, sugary, candy, white bread, cookies, ice cream, chips, those are things that are when you eat those, that releases blood sugar into the body very quickly versus and like sugary drinks like sodas, juices, complex carbohydrates, it takes the body longer to break them down into the sugar. So those are your whole wheat breads, your sweet potatoes, beans, quinoa, whole wheat pasta, brown rice. There's so many more foods outside of these two, these simple examples, but kind of just a general to give you an idea. Okay. So how the body normally controls glucose, kind of what happens when you eat. After you eat, the carbohydrates are broken down into glucose. The pancreas releases that insulin in response to the glucose. The insulin is what allows the glucose to go from the bloodstream into the cells, and then the glucose is either used for energy, storage, or to make other molecules. This is just a picture to kind of give you an idea of how the insulin works. So insulin, which is this purple triangle here, it's a key that fits into this insulin receptor. When the insulin goes into the insulin receptor, it opens the glucose transport channel, which is the green channel, that allows glucose to go from the bloodstream into the cells. So without insulin, that channel does not open. So in diabetes, it's kind of put simply, what goes wrong is the body makes little or no insulin. So it's either a production problem or the insulin is there, but the body is not able to use the insulin effectively, which is called insulin resistant. So it's this imbalance of insulin and glucose. It causes glucose to build up in the bloodstream instead of entering the cells. And when glucose it builds up in the bloodstream, it affects everything. So it affects all your organ systems, which we'll talk about in a little bit. But so that's kind of the basic, where the balance is thrown off. It's the insulin versus glucose balance. There are a couple of different types of diabetes. These are the most common types. There are a couple of other ones that I am not going to go over, but these are kind of the more common ones. So pre-diabetes, or also known as borderline diabetes, is the stage before type 2 diabetes. It's where the sugars are higher than normal, but not high enough to be diagnosed as type 2 diabetes. So it's a borderline diabetes and it is reversible. Type 2 diabetes is where the body does not make enough insulin and or the body's cells don't respond normally to the insulin that's present. So think about you have insulin, but your body's cells become more resistant to the insulin. So you don't have as many receptors, or the receptors there, but they're not working well enough. And so that creates this insulin resistance. This is most commonly seen in adults, but it can be seen in children as well, especially as we have more and more children with metabolic disease or obese children. And so type 2 diabetes is the one we see the most commonly kind of throughout the global population, especially in this country. Type 1 diabetes is very different. That is a autoimmune disease where your immune system attacks and destroys the insulin producing cells in the pancreas. So it is very different. It is not reversible. It's autoimmune. So your body is attacking the cells that make the insulin, and you cannot make insulin anymore. So that key that lets the blood sugars inside the cells is lost. This is usually diagnosed in children. I mean, it can be diagnosed sometimes even at birth or a couple months of age, to young adults. It can develop in adulthood as well. And even type 2 diabetics, type 2 diabetes is reversible, but over time you can develop an insulin resistant state, and then your pancreas, because it gets so used to working over time, it can get burnt out. And type 2 diabetes can also eventually become, they can also develop a lack of insulin. And then gestational diabetes is during pregnancy. It can develop in pregnancy and usually goes away after the woman delivers, but it does, for the rest of that woman's life, carry an increased risk of later on developing type 2 diabetes. Okay. So this is a picture kind of to depict the difference between type 1, which is the autoimmune disease, and type 2 diabetes. So the figure on the left here, this is the insulin receptor. there's no insulin. So that purple triangle that you see on the other side is not there. So there's no insulin. So the channel, you can't open it. The glucose is not able to enter the cells. In type 2 diabetes, the insulin is there, but that receptor is either broken or there's not enough receptor or because of too much fat. There's a lot of reasons you can become insulin resistant, but that receptor is not working. And so, same thing, the channel is not opening and the sugar is not entering the bloodstream. So, in terms of the most common risk factors for type 2 diabetes, and I'm going to focus mostly on type 2 diabetes because that's the one we see more commonly. And like I said, type 1 is autoimmune. So it's a little different. It's more rare. We do see it a lot, but type 2 diabetes is the one we see kind of day in, day out, very commonly diagnosed. So, risk factors for type 2 diabetes, obesity is probably one of the biggest risk factors. So, excess weight, waist size, so also where that waist is distributed. So if you have a lot of belly fat rather than hips and thighs, that belly fat has a higher risk of type 2 diabetes. Decreased activity levels. So if you're sedentary, you're not moving around as much, um, that has a much higher risk of developing type 2 diabetes because physical activity, I mean, physical activity is linked to so many things, right? But if you're not moving around as much, you're putting weight on, you're not using that energy. So that creates that insulin resistance state. And then family history, also genetics is very important, right? So you can be very healthy and you can still develop type 2 diabetes. So some of it is genetics as well. So you do see this more commonly in families too. And then certain races and ethnicities have a higher rate of type 2 diabetes as well. So um, certain ethnicities where we see it more commonly would be Black people, Hispanics, Native American, Asian people, very common, Pacific Islanders, more so than white or Caucasian people. But across the board, diabetes affects every single race, every single ethnicity. Blood lipid levels, so that's your cholesterol. So higher cholesterol is linked to higher risk of developing diabetes, especially if you have a higher triglyceride, so a certain type of fat in the body, um, or a lower level of the good cholesterol or HDL cholesterol. So bad cholesterol, higher risk of developing diabetes. And then age as well, the risk of diabetes goes up, especially after 35 years old. Polycystic ovarian syndromes, that's something that you see in women. It can cause irregular menstrual periods, excess hair growth, obesity. It's a hormone imbalance in women, increases the risk of diabetes as well. And I mentioned gestational diabetes earlier. That's the one you see in pregnancy. Right. So just some common symptoms of type 2 diabetes. And some people don't have any symptoms of type 2 diabetes. So, more the kind of textbook symptoms are increased thirst because your body has a lot of sugar in it, so it makes you more thirsty. You're peeing out that sugar, so you're peeing a lot, so increased urination, increased hunger, weight loss or weight gain, blurry vision because diabetes over time can affect the eyes, fatigue, increased infection risk or sores, and numbness, tingling, so neuropathy. So diabetics a lot of times can get, the blood sugars in the body affect the nerves and the nerve endings, and you can have decreased feeling in your fingers, your toes, and then you can step on something, not feel it, develop an ulcer that turns into an infection, then need an amputation. I mean, we see a lot of, unfortunately, like downstream effects of diabetes. And then some darkened discoloration of the skin as well. It's called acanthosis. You can see that as well. Like I said, sometimes some people don't have any symptoms. You can live with type 2 diabetes for years and not have it diagnosed. We have a lot of people who don't see doctors regularly, don't have blood work checked regularly. So it can, sometimes it isn't diagnosed until you have a complication from it. In terms of how it's diagnosed, it's based on your blood sugar. So there's a couple different tests for diabetes. There's a fasting blood sugar test, a random blood sugar test, and then your hemoglobin A1C. That tells you how your sugars have been over a 3 month period. So this is just some numbers. I don't know that this is too relevant, but just to give you an idea, there are some pretty strict criteria of how diabetes is diagnosed. Now, A1C is the one that we use very commonly in the hospital, and even outpatient. But in A1C, like I said, it's only the marker. It's a marker of your blood sugars over a 3 month period. So someone could be diagnosed as a pre-diabetic or a diabetic, and then 3 months later, if that test is checked again and the number is better, they may be cured or resolved or go back into a non-diabetic range. So it's not a long-term marker. It's more of that short-term marker over what your body's been doing over the 3 months prior. In terms of some complications of diabetes, so there are some that are pretty acute onset or fast onset, and can be life-threatening and very severe. So hyperosmolar hyperglycemic state is when the blood sugars are very, very high, over 600. That can lead to severe dehydration, confusion, even a coma. And then one that's more common in type 1 diabetics, but we still see it in type 2 diabetics, is called diabetic ketoacidosis. It's when the body doesn't have enough insulin. So that's why I say usually in type 1, but you can see it in type 2 as well. And it you go into and this can be triggered by infection, dehydration, exercise, sometimes too much exercise with dehydration. If the body doesn't have enough insulin, the glucose level goes very high. And then instead of breaking down glucose for energy, which is what insulin can do, it breaks down the fat instead. And that can cause basically release of acid into the bloodstream. That can be very, very dangerous. It can cause coma as well, nausea, vomiting, lots of effects of that. And that's the management for that is then a hospital admission, fluids, and insulin through a infusion. And then low blood sugar is also a pretty common complication of diabetes. And usually the low blood sugar comes from medications. It can also just come from sometimes especially when you have a new diagnosis of diabetes, sometimes your blood sugar can kind of drop while your body is getting used to the blood sugar and insulin changes in the body. So low blood sugar, you can have blurry vision, you can have pass out, lose consciousness, confusion, and even in severe cases, it can lead to seizures. And then this slide is a little busy, um, but chronic or long-term complications of diabetes, like I said, when your blood sugar is high, kind of think of it as there's just a lot of sugar hanging out in your bloodstream. It affects your nerves, it affects your arteries, it affects your veins. So it can affect every single organ in the body. So heart disease is very common in diabetics. It's one of the common causes of death in diabetics. So you can have a heart attack or just plaque buildup of the heart. You can have a stroke. So decreased blood supply to the brain or lack of blood supply to the brain causing weakness or symptoms on one side of the body. High blood pressure is also linked with diabetes because your blood vessels get narrowed and hardened. Nerve damage in the heart in the arms and legs. So that's the neuropathy that I was speaking about earlier, where you can have numbness, tingling in your hands, your feet, um, and that can increase your risk of having infections. So other nerve damage, like your body has nerves throughout, even the nerves that regulate your heart rhythms can be affected by diabetes, can cause irregular heart rhythms, can cause irregularities of the digestive system as well. So the nerves that control how your stomach is emptying can be affected by diabetes, and it can cause decreased emptying of the stomach or slowing down of the stomach emptying called gastroparesis, and that can cause poor appetite or feeling of getting full very quickly, nausea, vomiting. Then you can also have diarrhea or constipation with that. Kidney disease is a very, very common disease associated with diabetes because diabetes will affect how the kidneys are filtering. And so a lot of patients with diabetes, especially if it's not managed well, may end up on dialysis even if they're in kidney failure or need a kidney transplant. Eye damage can also be caused by diabetes, so you can have anything from blurry vision to blindness, um, because the eyes also have blood vessels and nerves, and so damage to these end organs can happen, especially with poor diabetes control. And skin conditions, so infections, very common in diabetes because bacteria and fungus and viruses like to feed on blood sugar. So if you're in a high blood sugar state, your infection risk is higher. Slow healing as well. So the diabetes can affect how your blood circulation. And so if you have an infection and you need that infection, or let's say a cut for that cut to heal, you need to have good blood flow to the area that you have an injury. And in diabetes, that blood flow can be affected. And then difficulty hearing as well. So you can have hearing loss more commonly in diabetics. And then dementia is also higher. You have a higher risk of dementia when you have diabetes. Increased memory loss. And again, most of these, if not all of these, are really if you don't manage the diabetes appropriately. So, thankfully, we have a lot of treatments, we have a lot of medications and non-medication treatments for diabetes as well. But because it is such it's kind of like high blood pressure sometimes where people will say, I feel fine, I don't need to take anything for it. I feel the same. It's you can feel fine, but if your blood sugar is 300, it is affecting your body, and sometimes you don't treat it until it's too late or until you have infection or need an amputation. So a very, very important disease to diagnose early because, like I said, at least with prediabetes and diabetes, it is reversible. But if you let it go for too long and do not treat it or work on, dietary changes, exercise, etc., then it can progress. And the longer you let it go, the harder it is to make it reversible. So that is it. Thank you. Sorry, no, that was kind of fast. Let me turn off my.
Good. More time for more questions.
Yeah. I kind of rushed through that, I guess. I don't know how to turn my share screen off. Okay, stop share. There we go. Okay. Questions?
I have a question. So if you are pre-diabetic, like you got family risk, and I don't know what pre-diabetes really means in definition-wise, but what options do you have? You aren't ready for medicines, but what could you suggest?
Yeah, I mean the biggest and the next talk will be kind of on conventional treatments of diabetes, so that'll be tomorrow. But the biggest thing, diet and exercise, those can go a really, really long way. I mean, there are lots of medications to treat things, but a lot of the medications have side effects. And so I think the earlier you can try to manage with diet and exercise and just make healthier food choices, um, and exercise, the recommended amount in a week, that can really go a long way. And also just kind of, stress level as well. Stress is just like an infection, like linked to a higher cortisol state, a higher your body just naturally releases more sugar because you're in this stress kind of fight or flight response. And so that high cortisol, high stress state can also increase your risk of high blood sugars, diabetes, and so yoga, meditation, um, and just yeah, but I mean definitely, diet, exercise, kind of a more calming, healthier life. Definitely combining yoga with that, I'd say, are the non-medication um, treatments. And I mean, it's the diabetes and weight are like this. So weight loss is huge, and there are many ways to lose weight. Medications are not just medication is just one way, but there's so many other ways to lose weight and lose weight in a healthy and sustainable way.
Thanks.
Hello, Riddhi.
Thanks.
Sorry, did I did you have more questions, Dr. Devendra?
No, I'm done. Your turn.
Okay. So I have two questions. First is related to A1C and the blood sugar level. So for years, I've had my annual physical and blood sugar level was mentioned, and it was kind of normal, below 100, right? This year was the first year when both blood sugar level and A1C was measured. So my doctor told me your blood sugar level is okay, but your A1C is high. So what's the relationship between these two? Which one is more accurate? And I'm confused.
Yeah. So the blood sugar level is a spot check, right? They're just checking a one-time blood sugar level. Usually it's a fasting blood sugar level, but the A1C is an average of your blood sugars over a 3-month period. So there are a lot of things that will affect the A1C. So if you've had an infection, or if you are more stressed, or if your diet has changed in 3 months, or if you've been on steroids for, on and off or something. So there are a lot of things that can affect the A1C versus the blood glucose is just kind of a one time, okay, what's going on in that moment. But so the A1C is more accurate, but it also it can change very quickly as well. So it's accurate for that 3-month period. And there are some things that do make the A1C not accurate, like if you're anemic, or because it's measured based on your red blood cells. And so if you have any conditions that increase your red blood cell turnover, your A1C will be affected by that. So like thalassemia, or sort of like sickle cell anemia, there are certain anemias that will make the A1C not as accurate, or if you have, end stage like kidney disease, or there are certain things that the A1C is not as accurate for. And then there is another test that some people do. It's called a fructosamine. But in general, the A1C it's over that 3-month period. So that's really what most clinicians will use to make a judgment on, okay, medications, no medications, but usually they won't, most won't take a one-time elevated A1C to say, okay, yes, you have diabetes or you don't. It's usually, okay, recheck it in 3 months. Maybe you had something going on, maybe it was a more stressful time, and see how it is in another 3 months, and then kind of see if it's still elevated in that pre-diabetic or diabetic range, and then decide, okay, treatment options.
Okay, so it needs to be retested within 3 months,
Yeah, 3 to 6 months.
3 to 6 months.
Yeah.
Okay. So no, okay. All right. Thank you. The second question is related to the low blood sugar level. So when we think of diabetes, it's usually like lack of insulin, or high sugar levels
Hmm.
in the blood. But like you mentioned it, and I've heard before that people having this condition can suffer with low blood sugar level. But you did mention that it is due to medication, or is that it can go high or low?
So typically, especially in type 2 diabetics, low blood sugar usually is due to medication, and then it can also be due to like a, change in eating, or if you were if you ate something that wasn't as carb rich, but you took the same medications. There are certain medications that cause your body to release insulin more. And so if you're eating differently and you don't factor for that, then yeah, you may overcorrect and have low blood sugar. I see low blood sugar more commonly in type 1 diabetics, because type 1 diabetics, the only treatment, and there are some, transplants and whatever, but the more mainstream treatment is, and we'll talk more about this tomorrow too, but
Yeah.
is insulin. So
Right.
type 1 diabetics, you need insulin. There's really no alternative. Your body is not making insulin, you need insulin. Without insulin, you can die. And so, but in our bodies, when we eat something, our pancreas is working. It knows, okay, hey, you ate this meal, you're going to need this much insulin, so let me give that much insulin to you. In type 1 diabetics, they're injecting themselves with insulin. Kind of, I mean, not guessing because, they kind of have to count, okay, I'm eating this many carbs and yeah, this X, Y, and Z. But and so they give themselves insulin based on how much they think they're going to need. So they're doing the work of the pancreas. Now, there's so much else that goes into how much insulin you need in your blood sugars. So, exercising can cause a high or low blood sugar depending on what kind of exercise. Stress as well, infections. There's so many things that type 1 diabetics, it's a lot more complex. So take they may have the same meal on day one and day two and take the same amount of insulin, but it can affect them very differently based on their mental state and what they've done that day. Um, but even in type 2 diabetics, because especially over time, your body can develop, your pancreas is working over time to overcome that insulin resistance. So even type 2 diabetics, you can have that same kind of response where your body thinks it's going to need more insulin, and then as a response to that, your blood sugar is dropped, so you have the low blood sugars.
Okay. So insulin secretion is more erratic in diabetic.
Yeah.
Just to add to that question, like I have seen like the diabetic patients are not advised to do fasting because of this low blood sugar. Conditions could arise anytime, and it could be critical to their health.
It depends. Yes, in general, it's just like I have a niece. She is a type 1 diabetic. She does ikashnu, she does upvas. She has learned how to adjust her insulin needs based on her fasting. But it's hard. It's much harder. It can be dangerous. It kind of depends on the person and how their understanding of and how closely they're monitoring their blood sugars as well. So there's a couple of different ways to monitor, but really, finger sticks is one, you check your blood sugar, and then there's continuous monitors as well. So if you're able to monitor more closely, especially in a fasting state, that is much safer. So it's not that you can't fast. I mean, I have patients who are on insulin, and we bring them in for surgery and we have them fast sometimes for 12, 24 hours even. And we just have to kind of either adjust their insulin accordingly or give them fluids to kind of help support them through that fasting period. But it's definitely a higher risk for that population.
Thank you.
Yeah.
So how often we need to do like a blood test?
Yeah, so it really depends on like family history as well. So if you have a lot of family members with diabetes, and if you're overweight or obese or have high cholesterol, most primary care doctors will check your A1C at least once a year, I'd say. But if you're borderline or pre-diabetic, they may check it every 6 months, sometimes 3 months, depending on if they're considering, medication. But I'd say at least six months if you're pre-diabetic or diabetic. But otherwise, just for kind of, it's not like for routine screening, it's not uh, necessarily indicated. So like routine lab work would be like a basic blood panel where they look at your fasting blood sugar. And then if based on that, there's concern for diabetes, then they may do a A1C test. But and if the older you get, the more risk factors you have, if you have any heart disease or high cholesterol, um, then they'll check it more often.
Thanks.
Anything else?
Okay, so just one question that is there some role of physical exercise or breathing exercise or some mudras in controlling the diabetic problem?
So definitely exercise.
Mm-hmm.
So exercise is recommended at least, you know, typically at least 150 minutes of exercise in a week. So 30 minutes every day or every other, like 30 minutes 5 times a week. Um, of aerobic exercise is recommended for pre-diabetics, diabetics, but just better diet, and it leads to weight loss as well, that exercise state. But definitely, like, stress levels are also linked to higher cortisol, higher sugar state. So that's where I would think, the breathing and the meditation would come in, but I have no idea about any mudras or anything specific.
I've reviewed some studies. I'll present on Wednesday, but there are some studies. But in general, to your questions, mudras by themselves are very rarely tested by themselves. People mention them. They look at the paper, it's just part of a package. So there's always lack of studies just for mudras alone. They're just part of a package. But when you look, and they say mudra, and look at the paper, it's actually part of a package, not separately tested. So, but yes, yoga is a meditation, isn't compared. So I'll present that work on Wednesday with quite a few studies on that. And some lecture there. Studies on that.
Yeah, so with control of diet, according to the problem, walking is also very necessary. Some physical work is also necessary, is it? And second, is there some role of calf muscles in controlling the sugar after eating? When we sit in the diamond posture, then calf muscles get suppressed, and it helps to control the insulin, or what we say, sugar in the blood. So do you think that is it okay, or
I honestly, I don't know.
Yeah, I can help you with that. There's work on this. So there's a physician in Houston who is studying the soleus muscle. And this is a muscle in the calf muscle really. And that muscle all muscles have different rate at which the handle activity, speed of activity, and how, so a fast muscle and slow muscles, what if we have those? And soleus happens to be mostly fast muscle, so it can burn sugar much faster. So it's not so much, it's the most efficient place to exercise because it's the best at burning sugar. So when he showed that study, it's become a big thing. But basically, it's and I saw on every Wednesday, it's basically like Tadasana or Vajrasana. Basically, we've been doing yoga all along. He just took out one part of it. But those postures do the same thing. The same muscle is, when you do the Tadasana, you stay as long as you can. That's what you're doing. They do a very simple one where you sit in a chair because of the aging, and then you just hold that muscle tight with your ankle up and your toes on the ground, and you keep it like that. You can keep like for over a day, about 3 hours of different over time. That's the study they did. But Vajrasana does it automatically as it does. Some of the yoga poses have been doing it all along. That's why they're good for diabetes, I think. So this explains why they work. But it's not different to those. It's the same thing. You don't have to. It's not running or moving. It doesn't work. It's holding it. It's not moving. I know some YouTube have got it wrong. It's not that. It's holding it under tension. That's what burns the sugar. So I'll talk about it on Wednesday. But that's a study from Houston. Then others have sort of in Europe have found similar data. But it's very, very similar to what we do, except you have to hold it over 3 hours in a day. You'll see it's almost similar, very similar muscle, how it works. So I think yoga has it, just didn't know how to market it. That's the same thing.
Yeah.
Just as I told someday that I got that I'm pre-diabetic. It was the sugar 104, and then second time I came to Orlando, then I got 109. And I saw 3 exercise for controlling the diabetes or pre-diabetes. So these are the points. So it is said that you have to praise 50 times at a time and 3 times in a day. And second, you have to walk at least 100 steps according to medical science of Ayurveda after eating any food. And then you have to sit in the diamond posture. So that also helps to control the sugar. Third, that you have to walk on the toes. So I have practiced that one, and last time I got a sugar test, and that I found that it is 92 or like 90. So it is under 100. So just I'm telling that if these parts of body or acupressure points, they are helping to control the sugar in the blood.
Mhm.
Yeah, we have to make experiments on so many people, then only we can justify or verify, or we can say with accuracy that yes, these points are somehow connected to control the diabetes in the blood.
Yeah, no, definitely. I mean, there's some exercises that can even cause the blood sugar to go higher. There's some that'll cause it to go lower. So it really depends on which muscles you're activating and for how long as well.
Correct. Yes.
I have a question about timing. So how long does it take after a meal, for example, for the sugar levels to show up in the blood? That could translate into what's the best time to do these exercises, or when should we sit in a Vajrasana, or immediately, or we there are while eating also, does our posture affect how we digest our meals, like sitting or standing? Sometimes we are eating and walking, and sometimes, most of the time, we are sitting and eating on a chair. But in olden times, we used to sit on the ground, on a low stool, and eat. That was preferred. I mean, that's how we were taught when we were children.
Yeah. So it depends on what you're eating in terms of like how quickly you'll see the effects in the bloodstream. So if it's something like a simple sugar, so if it's soda or candy or juice or ice cream, it's pretty quick. I'd say within 15 to 20 minutes, maybe even faster. If it's a more complex carbohydrate, then it does take a little longer. It could be anywhere from half an hour to 2 hours later, you may see the effects of that. So it really depends. Everyone's stomach emptying is a little different as well in terms of just the motility, but it depends on, I'd say, that simple versus complex carbs. And even if, depending on what else you're eating. So like if you eat a high fiber meal, fiber actually helps slow down the absorption of carbs, and it slows down how quickly that blood sugar is released into your bloodstream. So that's what I never tell my diabetic patients you should never eat this, because I don't think anyone's ever going to listen to you should never eat this. I think eat what you want, but in moderation, and make smart choices in terms of, okay, if you're having a high carb meal, have a lot of fiber with it, have your vegetables with it to at least slow down that the body's absorption of that glucose. But in terms of posture, I'm not sure. I guess it would make sense if you're activating your calf muscles more in that like cross-legged position, then your sugar absorption may be a little faster, but or the how to gets absorbed into your muscles and your for storage instead of maybe your bloodstream. But
Or insulin secretion could be affected because the pancreas uh, in a particular position are more active, or no?
I don't think so, because your pancreas kind of just the insulin gets released based on um the detection of the blood sugar. And even before your pancreas kind of knows what you're eating. As soon as you start eating, that kind of causes that immediate release of your pancreas starts releasing that insulin. That's kind of, I mean, even yeah, that's what I'd say. So it's hard to I don't know about the sitting position in particular, but
Thanks.
Sometimes it is said that diabetes is not caused because of the sugar. So, do you think that is it true?
so it's
Means,
there's a lot of
whatever sugar we are taking from outside, it is not causing the diabetes.
yeah. So again, it depends. Like, so type 1 diabetes, that's different. That's like autoimmune. So your body, you don't have any insulin. In type 2, it's more your it can be based on, if you have excess fat tissue or adipose tissue, that causes your body to become more resistant to the insulin, and just not moving around as much. So lack of physical activity, lack of exercise, that is what would cause it. Let's say in genetics too. Genetics plays a very big role in type 2 diabetes, and even type 1. But so it's not like, okay, if you eat a lot of sugar, you're going to get diabetes. It's more if you're obese or overweight or not moving around as much, or you have family history or bad cholesterol issues, then if you eat the same amount of sugar as a healthy person, yeah, your risk of getting diabetes is much higher.
So thank you very much, Dr. Riddhi, for giving an informative talk on diabetes type 1 and type 2, and you have explained everything very well. So thank you for coming to the session.
Thank you.
Yes. So now our doctors should start working on some yoga exercise also, how they can help to control the diabetes. So it would be more cost effective to the patients, and they will get, I think, non side effective treatment from our doctors.
That's true.
Yes. So now it is the time for meditation. Hope all are ready for that. And is someone ready to give the session?
I'm gonna go, but thank you, Andami.
Yes, thank you, Riddhi, for
Thank you,
coming.
Riddhi. Very good.
Thank you, Riddhi.
Tomorrow.
Awesome.
Okay, thank you. Okay, so yes, who will give the session today, or should I give?
Vandami, I'll give tomorrow and day after.
Okay. So today, what we do in the course curriculum, it is prescribed that we will practice relaxation. So would you like to practice relaxation? Then Rakesh Jain is already available here. So he has mastery on that.
I can do that, Samiji. Yes.
Correct.
Okay. So we'll practice Kayotser. Let's choose a comfortable position. Make sure that our spine, neck, and head are in a straight line. Position of hands, preferably Dhyan Mudra or Vitrag Mudra. Then control our breathing. Deep breathing. And then make a resolution. And I'm practicing Preksha meditation for the purification of my psyche. I am practicing Preksha meditation for the purification of my psyche. I am practicing Preksha meditation for the purification of my psyche. Yes, before we make a resolution, we should recite Om Mantra 5 times. We'll do it now. Let's recite Om Mantra 5 times. Take a deep breath. Relax your vocal cords and relax your mind. Let's practice coyote circ. First, focus your attention on the big toe of your right foot and suggest it to relax. Now take your attention to the other toes and suggest them to relax. Visualize the sole of the foot, the upper part of the foot, the heel, ankle, and the calf muscles. And then the knee, thigh muscles, and the hip joint. Suggest all these muscles to relax. Now feel that the whole right leg is relaxed. Now we'll move our attention to the left leg. Again, starting with the big toe. Focus all your attention on the big toe of the left foot and suggest it to relax. Focus on the other toes of the foot. Visualize each and every muscle. Suggest them to relax. The sole of the foot. The upper part of the foot. The heel, ankle, calf muscles, the knee, thigh muscles, and the hip joint. Feel that the left leg is now fully relaxed. Now we will move our attention to the middle part of the body. Let's first focus on the lower abdomen. Muscles surrounding the stomach. Suggest them to relax. Let's visualize the internal organs. The large intestine, the small intestine, kidneys, liver, spleen, and the stomach. Gently suggest all these muscles and organs to relax. Now let's take our attention to the chest area, the upper abdomen, the chest area. Suggest all the chest muscles to relax. Suggest the lungs and the heart muscles to relax. Continue deep breathing. Feel that the whole middle part of the body is fully relaxed. Let's move to the neck area. Neck muscles. Suggest the back muscles to relax. The right hand, starting with the thumb, other fingers, the palm area, the wrist, lower arm muscles, elbow, and the upper arm muscles, and the right shoulder. Suggest all these muscles to relax. Now let's move our attention to the left hand. Focus on the thumb, other fingers, the palm of the hand, wrist, lower arm muscles, elbow, upper arm muscles, and the shoulder. Suggest that all the muscles of the left hand to relax. Let's move to the head region. Bring your attention to the facial muscles and suggest each muscle to relax. Cheek muscles, lips, muscles around the nose and the eyes, ears, and the forehead. Feel that there is no tension in any of these muscles. Feel that your breathing has also slowed down. Feel that your whole body is now fully relaxed. Let's experience this state for a minute. Feel that your whole body has become light, like cotton. Let's keep our mind alert, fully aware. Now we'll complete our meditation by reciting the Om mantra 2 times. Rub your palms together and place them over your eyes. Blink your eyes a few times. And gently remove your hands and open your eyes. Vandami naman sami sami.
Thank you, Rakesh. For relaxation, the resolution is I am practicing relaxation for becoming free from mental, physical, emotional tension. So it is for relaxation, especially. So yeah. And yes, in contemplation also we have some affirmations. So that's why we do that affirmations in those practices.
Right.
Yeah.
I'll remember that. Thank you.
And you said Swamiji at the beginning or in the end?
Yeah, in contemplation, the affirmations, whenever they are spoken, we have to spoken there only. It is not necessary to speak in the beginning. But the four-step meditation or perception of breathing, perception of body, perception of psychic centers, colors. So here we have to speak that I'm practicing meditation for the purification of my psyche.
But just for Kayotsa.
It is just for the Kayotsa that we are practicing relaxation for becoming free
mental,
from all tensions. Yes. So since so many instructions are not required in one meditation, is it?
Right.
So, yeah. So thank you. Thank you for the.
Very nice.
It was very relaxing. Thank you.
Yes.
Vandaminam Swamiji.
Thank you.
Thanks, Swamiji. Very good.
Mm.
Kritigya asmi Swamiji.